Performing blepharoplasty or eyelid surgery for the past 35 years. Well, the main thing that we do when someone comes in saying, you know, gosh, doc, my eyes look heavy. Number one is analyzing exactly what is going on, because there is a lot of misconception as to who is the appropriate candidate and what is eyelid surgery per se. A very common conception is that, oh gosh, my upper eyelids are heavy, we're just going to cut that away and make it all look better. In some cases that is appropriate. Quite frankly, in many cases it is not, because that's not the cause of the underlying problem. This is in many cases the result of the brow becoming heavy, things starting to come down, making the eyelids scrunch on themselves. So it may not be the eyelids themselves that are the problem, it's more the position of the brow. A good analogy that I use is that if you have a heavy curtain on a rod, the rod bends, the curtain scrunches up, someone comes by, scratches their head and says, well, just cut the bottom of the curtain off. Well, perhaps the first thing you do is actually reposition the rod and see what the curtain really looks like before you start cutting it away. Also, if you do cut away tissue, you tend to burn a bridge. What happens is that if you then further try to correct that, you may not be able to close the eye properly and have chronic problems with dry eye, etc. So my job is to very carefully analyze the given individual and see, is it appropriate to perform simple removal of skin eyelid surgery for the upper lids. Now for the lower lids, a different story. What tends to happen when most people come in for is more what's called pseudoherniation of the periorbital fat, and what that is the bags under the eyes, the fullness that happens, and this is often very genetic. Even at a very early age, one can start having the heaviness and the baggy fullness, and it does make you look tired, you look heavy. With ambient overhead light, it casts a shadow, so it highlights it and and adds to that appearance. What we tend to do more often than not is a procedure from inside the eyelid. We tend not to make external incisions, which has a lot of advantages, foremost of which is that it has zero impact on the lid position. When one does external eyelid incisions, it is very common to result in some degree of a retraction or lowering of the lid, maybe changing the lid margin a little bit, that if someone's not very astute, doesn't really realize what it is, but the eyes look different. And that's not what we will ever have happen. So using the techniques that we use, this can often be done without even a bruise, with incredibly rapid recovery. Ideal candidate is the individual who has a reasonable degree of heaviness or fullness or bagginess under the eyes. That is probably the very best candidate for the surgery that we do. The restoration of that appearance, removal of that tissue, is often very dramatic and yet incredibly natural. The whole point is no one can tell that anything's been done except you look great. The eyelid surgery that we perform is unbelievably stealth. There are many individuals who will not even have a bruise after the procedure, even the following day. There is incredibly little recovery. There is little, if any, discomfort. One is up and about within a day, and it can be incredibly stealth. This is one of those procedures where there's no visible incisions, no sign of anything having been done. Well, one comes in and our facility at Caroline Point, private, quiet, best of the best individuals who work with us. We make this very seamless. Most eyelid procedures are very quick to perform. you are asleep for the time it takes, usually in the 15 to 20 minute range, awake within minutes, on your way home shortly thereafter, and feeling very good. Most of the procedures that we're doing are remarkably quick recovery. Individuals feel very good even after one day. You can drive the following day, be up and about. There is some possible bruising. If there is, it's generally easy to cover up within days. And there's little, if any, discomfort associated with this. It can look very good within days. The vision itself is not affected at all, with the minor exception that if there is a little bit of mild puffiness of the white of the eye, there could be perhaps a little tear film that may be noticeable, or give the sense of some mild blurriness for a few hours or a day, rapidly going away. But everything we do has zero impact on the eye itself. The general procedures that we're doing for the lower lid region are in the $4,500 range. Other factors that may play a role would be if we treat the skin surrounding the lower lid. We often will do a light pass with the laser that adds approximately $500 to the procedure, but can be very useful for eliminating some sun-related damage, changes, or fine lines and wrinkles. Probably not a bad idea to perhaps have some pictures, some candid pictures of yourself that we can look at, and also a sense of what is concerning to you. Of course, our job is to point that out, but those would be the basics. We've been performing procedures of this kind for a long time. We have it perfected, truly an art, and make this simple, effective, very easy, with, I think, great across-the-board results.